said, I can't come tonight. And I wonder if he's going to cover the same thing that he did that lecture a long, long time ago. And I said, which one was that with the red carpet in? And she said, yes. That lecture absolutely changed my life. And I said, guess what? That was the first time that I had ever heard Dr. Nasr, and that lecture changed my life too. I can tell you exactly where I was sitting, halfway back on the left-hand side, and my friend Mary was with me, and Mary is here tonight, so that goes back to January of 1981. And for those of you who are new, you really have a treat, because after you leave here tonight, you will know how to truly take care of yourself. Dr. Nasr has his PhD in biochemistry before he became an MD, so you can see how he approaches this whole thing so different than everybody else. And at that lecture, he came with his family, including 2 little girls. That was 1981. And I'm going to let him have the pleasure of telling you the very, very exciting news that he's going to tell you.
Okay. Good evening. Well, the exciting news she was talking about, that my daughter had triplets. And however, actually, that's part of the whole lecture about nutrition, because that was her fifth try. So nutrition did work, but to go back to the topic of tonight, why do we need food supplements? And to cover that, I have to bring you some of my own experience through my own family when I changed their nutrition, through my own patients when I changed their nutrition, and through my own friends when they listen, and through you when the story all of you tell me. And she, one of them today, I was telling her when she had severe disease a year ago, we were talking today, I forgot completely that she had severe disease a year ago. We were talking about something, and I said, oh, that's right, you had that severe problem and you don't have it anymore. I forgot even you had it. So, and that is proof, live proof, that when you have a patient who talks that, yes, that's true, if I'm not telling the truth, she will tell you, or, and some of you is witnessing in your own life the changes you have seen. All of you have seen some change in your life, so I know some of you already. So we don't have to really stress the subject too hard to convince anybody. Anybody who have any brain will be convinced about anything that makes sense and with logic and scientific proof. And if you can't believe that logic and scientific proof, then you don't have a brain, then you should not be in the lecture anyway, or you have to take ginkgo for about 10 years and come back. Because there are some people, especially the educated ones, you get to meet a physician who have medical degree, you think he have an open mind, and then you tell him, when you talk about drugs, there's no problem, surgery is no problem. When you switch the subject and talk about, for example, nutrition, he gets glim face, as you mentioned something, enemy of humanity or something. When you speak about vitamin, you insulted him. When you speak about that you feeling better, you insulted him without him being in control. So it is that problem that medical people have, and they are changing gradually, but not fast enough. The proof about food supplements that works, the lecture, I prepared it in the parking lot when I was sitting here to be sure that, and I prepared the next time lecture too, so I don't forget it, because I had some ideas about the skin. Next lecture is going to be a skin care. So I was worried driving here all the way from Chicago here, what I'm going to speak for an hour and a half about skin, you know. Then I was a professor in college, biochemistry, and all the ideas was about skin in my mind all the way here, not about this lecture. And then I didn't want it to go away. I start writing them in a piece of paper. Then I prepared today's lecture. Today's lecture is the first lecture I gave when I came to the United States. It was the same lecture, except it's a little bit more sophisticated. It is the same one I gave when I came 1968 is the first lecture. I remember that when I gave that lecture in Pomona, California. If you heard about Pomona, they have like a county fair, and Shaklee people that time got together with the environmental people that time, and those are the days of the environment, you know, of Sierra Club and recycling and anti-Vietnam War movements, anti-pollution movements. You remember those days were quite distressful situation in society, very unhappy society about the government. Everything they do was wrong. So one of them was pollution. One of them was food supplement. Adele Davis started talking about, you heard about Adele Davis, some of you? Start talking about vitamin for children. And she was immediately attacked by all the doctors. Linus Pauling started talking about vitamin C and cold. He was attacked as a quack right away. Dr. Schutz was discovered vitamin E, and he spoke about vitamin E, and he was kicked out of the country by saying that. And he's American. He was just saying vitamin is good. Immediately his license was canceled as a medical doctor, and he had to go to Canada. These are those days that if you say something different, then you are a communist and you get arrested right away and you put away. I don't know if you remember those days or not. Those days changed society because the generation who were fighting pollution, who started food supplements, who started fighting chemicals, are the generation exists right now that they still continue to spread the same word in the society. And in my own family, when I came to this country, before I came to this country, I was in Egypt. And I was graduate from Cairo University, biochemistry department. And then because I had one of the highest grades in agronomy with agriculture and biochemistry, School of Pharmacy, which is they have a department called pharmacognosy that's studying herbs and vitamins, only how to heal disease. And they had a department in the National Research Center in Cairo, and every year they select one graduate to do one research in each department. So the Department of Plant Physiology were looking for a candidate to do research for PhD program. They take one every year. And I got the letter in the mail that you've been selected to the Academy of Science to go and meet your professors and so and so. And then I entered through these big buildings, all these departments and all these things, you are 18 years old, 19 years old, and just graduated from college. I graduated younger. And then going to something like that, and I wasn't used to that because these are professors that you read their books. You know, these are the people when they walk to university, their nose touch the sky. You know, you don't even talk to them. You know, and here you're going to be talking to them in person and working with them. Gee, you know, that's something is beautiful here. Then I went to my department, and I knocked on the door. Well, I went inside, and then my professor met me, which she was about. I think she's about 33, 34 years of age. And she introduced me to the head of the department, which he was the head of the department in the pharmacy school also, in the same, but he comes, in the department. And I read his books, some of his books. They taught us to us, but I never met him in person. So I said, my name is Dr. Darwish. I know his picture. We know about him. And he graduated 200 PhDs. So he not only worked in that department, he works in many universities in the same time. So he probably have about 20 PhDs or 30 every year. He's managing the program. That's a very busy man. And he said to me, he was a very pleasant person. And he said to me, sit down and be comfortable and get a piece of paper and write down what I'm going to tell you. Your topic for PhD is this. Write down the role of antioxidant in the prevention. I'm trying to translate scientific words to regular words. I don't want to give you the scientific name of the antioxidant because it was not called antioxidant. They were called quercetin, rutin, and then the role of those in preventing heart disease and cancer and other diseases. And I studied that stuff theoretically in college, but practically I'm not an MD. I don't know what he's talking about cancer, about heart disease, because I'm a plant physiologist. I know plants, I know vegetables, I know vitamins, I know biochemistry, but to tell me those vitamins and vegetables have a role in treating disease, I didn't know that. He said, that's what your topic is going to be. I want you to work on that, to go to the library for 2 years, and then I see you 2 years from now. Gather all the information through the whole world, everything published, and present it to me in 2 years. And that's what you get your master on first. And then after that, if he accepts you, then you go to the clinical work itself, which is the PhD program itself. Then I did, in 2 years, I brought all the information to him. He accepted it, and I started the research. In about 2 more years, I'm about to finish with my PhD, actually. And the war broke in Egypt, 67 war. Then our building was hit by Israel. We got missile, went from the 7th floor, went from one side to the other side. And I was in the 11th floor. Then I had to find a way to get down, and I said, I'm not for this kind of things. I'm going to leave. I'm working here for nutrition, for the whole world, for anybody, and here I'm involved in stupid wars. I better leave. But during that time, something happened. During those 4 years, my mother and father, they were living in a village in Egypt. And they've been living there all their life. And he was a teacher, a businessman, and a farmer. And she was taking care of the farm with him also. We were not in Cairo. We never seen Cairo. We never seen electricity. We never seen refrigerator all our life until I went to Cairo University. So we didn't see any of that. And when I went to Cairo, I never saw television. I never saw radio. I just have my books and all of that stuff. So it shows you the difference between the lifestyle of a city, a lifestyle of a farm area. They're completely different. Even here, you find the lifestyle completely different if you go further and further in farm built. And then somebody from the family became a doctor, and he started treating my mother and father for arthritis with lots of aspirin. And those days, aspirin cheap. If 1 works, 2 is better. If 2 is better, 10 is better. If 10 works, 20 is better. So he can say, fine, take more. If you wanted to take more, then they start having lots of problems with bleeding ulcers, with this, with that, with that, with that, with that. and then I started giving them vitamins, which I was doing my research. I gave them vitamins and minerals and proper diet, and they start healing and start doing better. Then I came to this country, and I was introduced to Shaklee products. And then I was a little bit leery about it, so I had to travel to San Francisco to meet the man himself, Dr. Shaklee, because I have finished my PhD, and if he is what he is, I want to be sure to know the person before I send the products to my family or use it myself. And I asked him a question: how do you manufacture your vitamins? And how do you plant your crops? And what time of the day you collect your products? 3 questions, he has to answer them right. Because it has to be organically fertilized soil. It has to be, the crops has to be accumulated or collected at early morning before sunrise. And it has to be processed by lyophilization, freeze-dry process immediately. So if he didn't answer the 3, the product is not a live product. It's not a good product. So when he said that, I was convinced. Then I went back, I bought $1,000 worth of vitamins, and I sent it to my father and mother in Egypt to take. They continued to take it until about 7 years ago, where they met another doctor, and he told them, you don't need any of this stuff. What you have is arthritis, and here are your drugs, newer drugs, better drugs. Well, they developed ulcers again, and they bled, and they both died from bleeding ulcers at the age of 84, and she was 81. And I'm not saying that everybody has a definite date to die, but we cannot put responsibility on God. We have to put the responsibility in ourselves, that we are responsible for our own actions. And we cannot just say that it's God's way. It is. Everybody has date, but we have to do whatever we can to prolong that date, because we don't know that time is. You don't know when I'm going to die. I don't know when you're going to die. Why we should stop working and living right now and hold our breath until we die, like the people who wanted to meet the spaceship coming with the mates a couple of years ago? Why we should be stupid like that, to die like that, like they did? You remember the story about those things. So when he did that, I didn't know. Then they died. So I learned something from that nutrition have worked. And I should continue to be encouraged about it. The second thing that encouraged me about nutrition was when I came to this country, I was working as a biochemist. I was lecturing about nutrition because I know it works. But it was not known to everybody that it works. So I had to explain why vitamin C work, why E work, why the good vegetable work, why the fibers work, why this work, why this work. And it's easy for me as a biochemist to explain things to people, because your biggest enemy is you find another biochemist to challenge you in what you're saying. And I was ready for that because I was the best in my field, in the world. I know my field of antioxidants, so whatever he's going to say, I'm going to bring all the papers. I have proof that what I'm saying is correct. And it happened. In one lecture, somebody stand up and say, are you a doctor? I said, I finished my doctorate degree. He said, no. Are you an MD? I said, no, I'm not. He said, no, because if you're not an MD, you really shouldn't say these things. I said, okay. What I'm saying is correct, and if you have any question about it, tell me right now. He said, no, it's just your qualification. You're not an MD. You're just a finished PhD, and that's not enough. He was an MD himself. So I said, okay. I applied to medical school, and next morning I filled the application, I was accepted by University of California, San Diego. Then I could not afford the tuition. There was no scholarship. I couldn't afford it, so I couldn't go because I didn't have the money for it. Then I was accepted by University of Guadalajara, Mexico. Then they told me that the tuition is much less and we're going to help you and everything, all the conversation in English. Then I get there, I find out that they told me the class is in English. And then when I go there, they told me, no, the teaching is all in Spanish. And then I had to relearn Spanish in 2 weeks to be able to enter the university and study medicine. In the meantime, the medical school started already. So during that time, I had to get a book in English, and was brain neuroanatomy that time, and learn from it while I'm studying Spanish in the same time. And I have pictures of the brain in the book, and pictures and pictures and pictures, and then I passed Spanish 1. I said, no, there's Spanish 2 and Spanish 3, and there's Spanish 2 and 3. And then I go to register, I go to the class, it was the final exam for neuroanatomy that moment. I said, what is it? I said, we're going to the exam. I said, where? It's a written exam? No, it's a practical exam. I said, gosh, okay. Then I go to this, they have table, they have slices of brain, and they have pins, and you have to name the organ the pin is embedded in. Well, every picture, every table was exactly the picture I saw in the book. So I remember every single one, except the 3 out of 100 I didn't remember. So I always joke, so I wrote 3 jokes in Arabic. and in actual Arabic language in the last 3. Because I was sure I'm getting 97%. So if he gets mad, then I just tell him, this is my language. I didn't know it in Spanish. Then only about 5 people passed the exam out of 800. I was one of them. And then the guy said, it must be your PhD that gave you this qualifications. I told him, no. I remember it from the book. And I said, okay, you must have 100% because you made 97. What are the last 3? Because you must be right, but I don't understand that. I smiled. I told him, I don't want to lie to you. Actually, these are 3 jokes in Arabic because I didn't know at all what I'm doing. And he started laughing and laughing. He said, if you lied to me, even I would have believed it, and we became friends. And then next day, he called me to his department. He said, we want to hire you as a professor in the University of Biochemistry and a student, and you don't have to pay tuition, and we'll give you money to live in, and we'll give you food and salary even that. So here I am a student in next class. I'm a teacher to my friends. I'm a biochemistry teacher in Spanish. And I told him, I only have 3 weeks in Spanish. He said, don't worry about it. So anyway, this was my experience. My experience in that university was great because I tried to push nutrition through the practice I was doing. So in one hospital I was practicing in Guadalajara, if you've been there, in an area called San Juan de Dios. It's a section of the town. They have a big, huge hospital, psychiatric hospital. It must be around 1,000 or 2,000 patients, I'm not sure. Huge psychiatric hospital. And then during that time, I talked to my professor, Dr. Ibarra, around that time. I said, could it be some of those crazy people missing some nutrients in their brain? Could it be? He said, well, you're a biochemistry professor. Why don't you tell me what you want to do? He opened mind right away. Different from what I saw here, different what I saw there. There was no ego. There was acceptance right away, open mind right away. He said, what do you want to do? because he cares about his patients. He's not there for money. He's there because he helps. I told him, I think we should give them vitamin B complex, and we should give them lecithin. We should give them all of the supplements. And I came to the United States, collected Shaklee product donations from the Shaklee people who were master coordinators at that time. And I had a whole car full of vitamins, taking it to the hospital for free. And we gave those vitamins to a selected group, which were about 200. They had schizophrenia, all of them. And out of the 200, 180 of them improved within 6 months and left the hospital normal. After they had been in the hospital almost 10 years. So that gave me more confidence that nutrition really works. Are you following me or no? My daughters were born that time, and when they were born, I put in the baby bottle, crush all the vitamins, and mix it with milk, regular milk, cow milk, and give it to them as an extra supplement because I didn't trust if my wife was giving them enough supplements through breast milk. So I want to give them more. I wouldn't do that to my own daughter unless I'm sure. And this was just born. They were just born, and in the first week, I put them on the bottle of the way with vitamins. I had no fear of toxicity that they talk about in the books, and if you take too much vitamins, you die, and all of this garbage. I didn't see it in my practice. I didn't see it in biochemistry. I didn't see it in my research, and I'm not worried about it. So I give it to the girls, and they never got sick. Neither of them. One of them is 22, and the other is 23 right now, and they never been sick. The 22, she tried to get pregnant 4 times, and she could not. Then I have helped her by changing her vitamin program, and changing her diet, and changing her hormonal system, and she's under the care of another doctor. And I don't want to go through details of what I have to do through the process of in vitro fertilization, what I was involved in that process. We had to get a hotel next to the clinic. We had to put her in a sleeping pill so she doesn't wake up and they fall off out of her or something. I was taking precautions about every step. Doesn't happen. And she got pregnant on the 10th day, and that time we stopped the medications that I was given to calm her down, and then she went through and she had triplets. Each one was 6 pounds and was 9 months and 1 week. And they say they never had somebody past 32, 33 weeks. However, when you have children so healthy and a mother so healthy, you have to think about the size of those babies, what they're going to do to the organs inside, the liver and the kidney and the heart and all of that. And that was not done. There was no follow-up on that. I didn't know that. So when I went to last Thursday to visit, to see the babies, I want to see my daughter first, so I went to her room. The doctor was talking to her, and I was in the bed next was an empty bed, so I sat on it, and I was listening to the conversation between him and her. And I told him, "Are you the doctor?" He said, "Yes." I told him, "I'm her father, and do you think she has congestive heart failure? Her heart is about to stop." He said, he opened the curtain, he said, "Why do you say that?" I said, "Because look at the way she talks. She doesn't have enough oxygen. She can't even take her breath." He said, "Maybe she has asthma. Maybe that's a cold. Maybe this." I said, "That's maybe. That's what gets us in trouble, is the word maybe. We don't want to tell somebody maybe you're pregnant. We want to tell them you are or you're not. We want to be sure. Maybe you have cancer. We want to tell them you have cancer or you don't have cancer. You follow me or no? Maybe it doesn't count in medicine. Patient doesn't want to hear maybe. He wants to say, do I have it or I don't have it? Don't give me that in between stuff." Then he said, "Okay, I'm going to call a cardiologist and internist consultation." He did. I was on the way to my house there. By the time I arrived to the house, the phone was ringing. The internist on the line telling me, your daughter in severe congestive heart failure. She's in a very serious condition. She might not live tonight. That's what the internist is telling me. And you want to talk to her. He told her already that. So she was crying on the phone and all of that, and you come over, and I went to the hospital, and we called the cardiologist, and then she grabbed me from she said, don't let me die, I want to see my kids and all of this. And here's the girl being short of breath all night, telling the nurses, I'm short of breath, and nobody thought of even taking a chest x-ray or blood gases or EKG. Because she's 22. So 22, you must be perfect. This is why basketball players, 22, drop dead on court, because somebody assumed they were perfect. They did not do their job right. So I treated her with the doctor because I was the main doctor who was treating, because I have more experience than he did, the cardiologist. Even I find out we graduated together. When he came in, we know each other. Then I told him he agreed about everything, but he didn't know how to treat it. So we find that she had 90 pounds of water extra in her body. 90 pounds. Where is the water? In the heart, in the lung, in the brain, in the kidney, in the liver, in the legs. 90 pounds. So you expect every organ to fail. And that's what was happening. That's why she was in danger. Her oxygen was only 50, which normal is 95. So I had to separate myself from being a father to being a doctor. So she asked me, am I going to live? I said, I don't know. I'm doing the best I can. And then I didn't assure her she's going to live, because I don't know if she's going to live or not. I don't want to act as God. I know God knows, and I never tell a patient if you're going to live or you're going to die. I said, I don't know. I do my job. It's up to God. He heals or not heal. But I cannot promise you that. I promise you I do the best I can only. Then I started on oxygen, Lasix, and medication, and this, and this, and this. And by 3 o'clock in the morning, we removed 30 pounds of fluid. 30 pounds. And she started breathing better. The next day, we removed 20 pounds. And third day, we removed 10 pounds. And then they want to continue her on medication for months. I told them, no, she's not going to need it. We're going to stop the medicine at the 4th day, and she's going to just go home normal. And she did. In perfect shape. She lost 75 pounds, and she was in great shape. No drugs at all. But what I did during even that time, for every gallon comes out of urine, I was adding vitamins in the IV. And they asked me why. And I just look at myself. I want to smile. I want to laugh. I say, you can't understand when you're removing a gallon of water, you're removing the vitamins, you're removing the minerals, you're removing everything with it. Does it make sense or not? You got to replace it. Otherwise, the patient can have cramps and leg cramps, and potassium will be down. This will be in trouble. And because we added so much vitamins, we never saw any complication at all, and she went through it. That's another example. So the question here, why do we need food supplements? To understand this, I did some study to find out, if you look at the United States, which right here in South America, and you look at Africa and the rest of, and this is Europe right here, you find the world is divided into two kinds of people. The underdeveloped and the developed. The industrial and the basic. That's what basically, the rich and the poor. When we study the type of disease that those people in underdeveloped countries die from, what do they die from mainly? Right, isn't it? Infections of different kinds. Cholera, parasites, whatever you name, infections. What do we die from here? What is the first disease kill us? Heart disease. Heart disease, there's 1 million people in the United States die from it. What's the second one? Cancer, you're right. There's about 600,000 people die from that. I bring this in front of me so I don't forget. What's the third problem bothering us? We have digestive, maybe I should use different color. Digestive problems. Problem with ulcers, problem with colon, problem with digestive system. And what is the fourth problem we have? We have problem with brain diseases. All kind of Alzheimer's, strokes, all kind of things. We have problem with hormones. We have problems with immune. And then we have all kind of different problems. What is the difference between their problem, those people who are not developed, they don't have a car, they don't have a TV, they don't have any of what we have, and us? Their diseases is easy to treat. If a child has a cholera, you can cure him. If a child has malnutrition in Somalia, you can cure him. You give him food, they get better. Our diseases, are they curable like these diseases? Are you following me or no? So the biggest difference, the more advanced we got, the more dangerous diseases we developed. You understand? And with the advances we have, we cannot still cure heart disease. We still cannot cure arterial. When we look at Africa, when we look at South America, in those villages, we do not see coronary artery diseases. We do not see arteriosclerosis. We do not see hypertension. We do not see cancer. Very rarely you see. You examine people. They maybe have infection, but they don't have any of this other stuff. You analyze them, they don't have. And I work there. I work here and I work here also, in both continents. So I learned something. There is something we have done here to our environment that causing these problems. That's the first thing I start thinking about. And when we look at our planet, Earth, right here, we find that this planet Earth have the same air around, have the same water, have the same environment. It has one single creator, God, to it, and we all started from two individual, Adam and Eve. We supposedly believe, we should believe in that. If people don't believe that, they were started from monkeys, we evolved, they can believe that ancestors are monkeys, they're entitled to that. But I am entitled to say, no, it was Adam and Eve, not monkeys. So this creator is not going to create a continent that the north will die from incurable diseases and the south will live. It's impossible. It has to be a man-made problem. That man made himself his own problem. You follow me or no? If it's an ozone problem, or air problem, or soil problem, or water problem, or a stress problem, we made it to ourselves. So let us analyze this point and look at it. If we look at our life from the year 1800 to the year 1998, we find that the number of people they developed heart disease were not increasing until around 1900 and start going up. That's heart disease. And the number of people that developing cancer were not increasing until about 1900, and the cancer starts going up. And the number of people have digestive problem were not there and starts going up until now. More and more people have digestion problem. And the number of people, we're running out of colors, have depression, it's going up. Suicide is going up. Other diseases, arthritis, this and this and this and this and going up. We don't have to go through every disease anymore. We just let us make it simple right now. Is that true or not true? Let me tell you some little story here. 1970, 68, 69, I said that in the lecture. And the doctor, before I became a physician, I was told that's not true. Cancer is not going up. Heart disease is not going up. Hormones, diabetes, digestive, there's none of this is increasing. Those people in those days, they had it, but they didn't know it. That was the argument. I said, I don't believe that. But that was the doctor telling the people. They died just like from the same disease like us. Exactly, we know difference. We have no problem whatsoever in our environment, in our food, in our air, in our water, in our stress. And this was published in medical books, that none of the stuff, nutrition or stress or chemical, have anything to do with disease. That was in the medical book until only the last 5 years they start recognizing the role of these things. By the year 1980, I was still lecturing. That time I just finished cardiology and became a head of cardiologist in a hospital, so there's no doctor can tell me anymore that you're not a doctor. So I became a doctor, I became an internist, I became a cardiologist, I became even have a degree in nuclear physics to become nuclear cardiologist. So when I was given the same lecture, but the degrees changed, so I have less argument in the audience. I don't hear complaints like I was before. So when I talk to the doctors about it, who argue about it, I tell them, if we compare 70 to 80, is it going up or not? They agree to that. So we have a problem and it's still going up. Why is that? Why this disease is going up? Is it because from the year 1800 to 1998, the number of chemicals in our air starts going up by the year 1900, Industrial Revolution or no? Is that true or not? The chemicals in the air, more cars, more pollution, is that true or not true? Can this cause some of these diseases or no? Okay, that's the air. Then we have the food. There is more chemicals in the food we eat. Is that true or not? Naturally, you agree now, but those days they didn't agree. They say there is not. Actually, there was an article one time when I was going to Tennessee, Memphis, to give a lecture, 1971, I believe, or 1970. I read in an article in a journal that food additives better than natural stuff for us as human beings. And this was commentary writing that. So there are people who believe in that chemicals are better for us. If you ask a drug addict, cocaine addict, he'll tell you cocaine is good for him. And he believes in that. So alcoholics, they say the same thing. So we don't have to listen to none thing doesn't make sense. The amount of chemicals in the water is going up. And then the amount of radiation in the air went up. It's going up. Can these contribute to those or no? And those chemicals can food, especially vitamins, antioxidants, and minerals, and good diet help in that or no? And we're going to be talking about that in a minute. That's the title of the lecture. To get to that point, I have to convince you first that we are different than those people. They are healthier than us. Would I like to go live there? No. I would like to live here, but I like to be healthier here than there. You follow me or no? I don't want to go live in the jungle, but I want to live here, but can I change it to be healthy? And I did in my practice, I did in my lectures, I have proven that my patients are doing very well. So this is one factor that we have to consider in talking about that is the cause of diseases. Then we go to another one right here, and we look at another curve that is important. From the year 1800 to the year 1998, we find something happening, and this is printed, proven, published, even by the Department of Agriculture of the United States of America published this stuff, that the amount of vitamins, good vitamins in food have gone down. These are the vitamins. And the amount of minerals, especially trace minerals, have gone down. Is that true or not true? And then the amount of good protein that the people eat, they used to eat in those days lots of vegetable protein, converted to animal protein. Animal became the main source of protein, and vegetable protein went down, where animal protein went up. Are you getting the picture right now? The changes we have done have factors in our life. The amount of carbohydrate, they used to eat lots of bread those days. Carbohydrate consumption went down. The amount of sugar, carbohydrate, went up. Is that true or not true? See, that I'm taking one ingredient at a time, because the nutrients which the body needs are vitamins, minerals, protein, carbohydrate, fat, and water, and oxygen, and fibers. And let us just analyze each one of them to prove that we have done something wrong to this food we need. And if you believe you can live on drugs without vitamins and mineral and protein and good that, then you must be crazy. There's no doubt that when you have good vitamins and good minerals and good protein and good carbohydrates and good fat and good water and good oxygen, exercise, and good fiber, you're going to be healthier. Is that true or not true? So I'm here trying to break it down one at a time to show you. The amount of fat, the unsaturated fat, you know fat is two kinds. Saturated, that's bad, and unsaturated, that's good. Oil versus margarine. Oil versus lard. They use lots of oil, and the consumption of oil went down, and the consumption of lard and margarine went up. As a matter of fact, margarine was very popular in the 50s and the 40s. That if you don't use margarine, you must be, you're not smart. You know, you have to be using margarine to be intelligent. Do you remember those days or no? You got to get the margarine, that stuff that you put on the shelf for 20,000 years, it doesn't expire. Why you get the oil that if you expose it to air, it gets rancid in about 1 week? Because it's better. It's alive. Of course, anything alive, you're going to expose like a glass of orange juice, you're going to leave it for 1 week, it's going to taste different. But if you have a glass of synthetic orange juice, you can leave it for 1,000 years, it tastes the same. Because it kills the bacteria and us, both. So it's not going to deteriorate, nobody's going to touch it. So this was the concept, how can we keep the shelf life longer without refrigeration? So these changes and the consumption of water, good water, went down. Consumption of Coke, Pepsi, and alcohol went up. Is that true or not true? Was replacing that, replaced that. And you noticed the older days, they used to have the water. And now you have the Coke, you have the Pepsi, you have the beer, you have the diet drink, you have something else beside water. As a matter of fact, restaurants now in California and places refuse to serve water unless you ask for it. Because they waste so much water. They put the water, people don't drink it. Have you noticed that? And not only we have this problem, but the fibers consumption went down, and exercise also went down because we have more cars, and we have even become so we hated exercise so much. We had the car first instead of the bike. Then after that, we developed inside the house. Why should I walk inside the house very far? Then we have remote control for the TV, because if you walk to the TV to turn it off, you might have a heart attack, you know? So we have to have a remote control. And somebody stupid, he said you go like this, turn TV off. You know, when you want to go to sleep, you're going to go like this to wake up yourself up. You know, when I want to go to sleep, I don't want to hear them. So anyway, we become lazier and lazier and lazier. Then we start developing arthritis, heart problems, and so on, so on, so on. This is the problem. Besides this is problem number B. And problem number B changes here, if you are following so far, can contribute to disease or not. So we already proven that also. Then we go to the last problem that we have. So after that, you don't have any excuses except to take your vitamins and take care of yourself. Because if you don't, then you're going to wait for the time you're going to have a surprise, either by a stroke or a cancer or heart disease or whatever, because you're not a superhuman being. You're not different from me or I'm different from you. We both. What goes around comes. If you treat your body well, you're going to enjoy life later on. If you treat it bad, you're going to pay the price later on. You understand that? This problem is we start seeing something new. We start seeing bacteria infection different than we had before. Different than we used to have. We start seeing viruses than different what we had before. That causes chronic fatigue syndrome, like Epstein-Barr virus, cytomegalovirus, herpes 1, herpes 2 virus, AIDS virus. All these viruses are going up. We start seeing yeast, Candida, is overgrowing inside the body. This is problem number C. having so many bacteria, your body's fighting in this air right now. I'm talking, I'm giving you all the germs I got from my patient today. Every bacteria I got, I'm giving it to you. Every virus I got, I'm giving it to you. Every candida I have, I'm leaving it behind. You're doing the same thing. We have the same air, we have the same air condition, we are exposed to the same environment. You follow me or no? But we have a defense system inside the body to fight back. And can these problems here, plus these problems, number B, right here, plus the problem with chemicals, number A, contribute to all of these, to the disease, to all together? And the answer is yes. If the answer is yes, then let us see what should we do. Why did the vitamin go down? Why did the mineral go down? What did the protein change? Because these are the supplements now we're talking about. We're not going to add each one. Why is the fat change? Why should we add certain amount of fat? Lecithin is fat, EPA is fat. So these are kind of fats that we have to supplement the body with because we need it. Vitamins, minerals, protein, and fat. Why we have too much infections than before, and then the chemicals and everything else. Regarding to the vitamin situation, to talk about the vitamin, we have to look at the human body. The human body is made from organs. The first organ is the skeleton, is made from bones. The bone is made from cells. And those cells make what? Blood. And blood is important to us. To make blood, what do they need? What did the bone need to make blood? They need the proper protein, carbohydrate, and fat, and the vitamins, and water, and mineral, and oxygen, the proper thing. This person in front of us have organs. One organ some people don't have, made of also cells, require the same thing. And another organ which connects arteries, called the heart and the cardiovascular system, 1 million miles of arteries, made also from cells that need the same nutrients. And there are more organs. There's the lung right here that also needs nutrients. And if the bone doesn't get enough nutrients, then you will have anemia, you will have leukemia, you have fatigue, you have poor immune system, you have no defense, and so on. If the brain doesn't get enough nutrients, then you will have problem with the brain function, memory loss, and so on, so on. So we talk about many things. Lung, if you don't get enough nutrients, then you're going to have emphysema, you're going to have allergies, you're going to have sneezing, you're going to have sinuses, you're going to have all of these problems. If the heart doesn't get enough nutrients, then we have high blood pressure, heart attacks, strokes, and so on, so on, so all of these things. And we have also the digestive system right here that absorb food. It's made also from cells and also made from bacteria. And when we come to the digestive system, not only it needs the protein, carbohydrates, fat, and vitamins, water, mineral, and oxygen, also need extra two things. What are the two things? Fibers and proper bacteria inside. So to solve these problems, we have to look at each one of those. We add the fibers and bacteria to solve. This person have other organs, have skin around. We're going to talk about in the next lecture. This one I'm not going to put it on now. We'll put it on next time. In the back, he have 2 kidneys and also needs the same thing. And also there are 2 organs right here and 2 here, not in the same person. These are the glands in the women, the ovaries and the testicles that also need nutrients. And also we have hormones in different parts of the body that also need nutrients. So the summary to all of that, then it becomes that the human body is made of a cell that needs protein, carbohydrate, fat, vitamins, water, mineral, oxygen, and indirectly in the intestine, you're going to need fibers and proper bacteria. You follow me or no? And I already proved that all of these things have been changing already. We don't have to go backward now. Now, when the protein goes in, and the carbohydrate, and the fat, and the vitamins, and the water, and the mineral, and the oxygen, and the fiber did their job in the intestine to help, and the bacteria did their job to help, then we have life inside the cell. Because normally, the cell is bombarded by 2 problems. One aging problem that is going on inside, that those things have to fight, which we're going to be talking about next time in the next lecture, and aging of the skin, how to prevent it and how to correct it. And also, the air the person breathes could have chemicals in the air that add problems to the body. The food he eats could have chemicals. The water he drinks could have chemicals. He could be exposed to radiation also. You know, I forgot something about radiation because I just got carried in other stuff. I forgot about radiation. I want to show you a map right here as an example to United States of America about radiation. These are the areas that have small blocks. They have the most radiation after we experimented with nuclear bomb in 1941. 1941, we're blowing bombs in the air, New Mexico, white sands. Usually you are afraid your enemy come and bombard you so it can kill you. So what you do is you blow yourself up instead of waiting for the enemy to do it for you. We did that. As a matter of fact, before Madame Curie discovered radiation, we used to carry plutonium, uranium in our hand without knowing, mine it, and carry it in our pockets as jewels, as something important, because it shines in the dark. This is what one atomic bombs, or several right here, now, until today, that's until today. This is the amount of radiation we have from that from 1941 until today. We still have it. Even Wisconsin right here. You're not exempted. Right there. So we have radiation. We have, where was the atomic bombs made? Were made in Savannah, Georgia. Right here. Have you seen, in 25 years ago, the guy who came out and say that they used to, for the first time the secrets came out, they used to store the uranium and the plutonium waste in cardboard boxes outside the plant. He announced that 5 years ago, and he was fired from the Nuclear Energy Commission right away. He was the director of Nuclear Energy Commission. But his heart couldn't stopped telling him, you got to tell the public, you got to tell the truth. He came out and told 2020, he was fired next day. But at least he will get reward of what he said, because he saved lots of lives. But what he said, because lots of changes were made since he said those things about radiation. We start to be more careful about radiation in society, but maybe it's too late. Unless you take an antioxidant, then it's probably too late. They stored it here, and they discovered that about 10 miles away, 20 miles away, turtles were radioactive. And 40 miles away, lakes would have fish radioactive. Then they make quarantine zones, bigger and bigger and bigger area you cannot enter because it is radiation. But this didn't stop that way. It went underground and going underground water, and you know the Earth's underground system is connected to each other. You follow me or no? The underground water goes to the oceans, all of it from, in the United States we have two, the Pacific belt, that this group goes to the ocean this side and this group goes to the ocean this side. In Europe they have the same, it goes to the ocean and the fish come from the ocean and the cycle continue through the whole world. So this is a problem we created. It was not created in Africa. It was not created in South America. We created it. We didn't need another enemy to bombard us. We did it ourselves. Are we safe? We are not safe. You hear every day one state refusing to take nuclear waste. Another state refusing to take nuclear waste. Another state have nuclear waste still in the government, take it out from our state. We don't want it. Did you read about the things or no? Did you read about the Southern people? Black people, they were experimented with radiation, injected with radiation. Did you read about that or no? Because we tended to read the stuff we like to read. We ignore the stuff we like. It doesn't touch our life. We usually, when we read, if we like sports, we go to the sport page. If we like this, we go to the economy page, stock market page. You know, we don't read everything in the paper. But if you pay attention carefully to the news, there are lots of information are very dangerous. Because that was done to your own people. And that was also happening nowadays. We are radiating chicken, radiating eggs, radiating meat, radiating food or not. Is that true or not true? And we were told it's safe. Who's guarantee me? I need a guarantee that it is safe. That if anything happened to my great-grandchildren, they are responsible for it. They said, no, we'll guarantee nothing. As a matter of fact, even if you produce milk with hormones and the other produce milk without hormones, the people who have produced milk without hormones in Wisconsin, they wanted to put on the label, our milk have no chemicals in it, hormones. They were ordered by the federal government not to put it on the label. Did you know that or not? Only by word of mouth we know Altadena doesn't add hormones. We know certain companies. By word of mouth we know which company is good, which company is bad. But it's not officially in the supermarket. Right here in Harper's nuclear reactor in Washington State, close to Spokane, Washington, the storage of all the nuclear waste from here went to there. And there are trillions tons of plutonium stored underground in very thick concrete casings that we never, even God himself, we never can break it. That's what the scientists thought that time. They said never, never, nobody can ever break this concrete casing. Concrete itself will deteriorate by itself. Let's not be so stupid to think that concrete is going to stop plutonium. You know, which one's going to beat the other? Which one are going to outlive the other? Right or wrong? The pyramids in Egypt, 7,000 years, of 5,000, they're falling apart. But plutonium half-life is 1 billion years. So which one is going to live longer, the plutonium or the pyramids? So the concrete is not going to survive. And that's what's happening right now. The concrete cracked, and the plutonium is leaking down. And the people of Washington State filed lawsuit after lawsuit after lawsuit to protect their children, and the government put in $60 billion to try to put another casing underneath the other casing, and they're failing to catch it. And they tell the people, why you have to worry about, it's not going to reach Columbia River until 20 or 30 years yet. Why you worry? It's not going to reach Columbia River that feeds California and Oregon, Washington State and Utah and all of these things right here in 20, 30 years. You're going to have plutonium in the water? You follow me? Eat a piece of fish, you have cancer right away. So we have to take these things seriously, because these are facts from newspaper articles and reports. It is not intended by the newspaper to scare people. It's intended as a public information so we can take precautions, we can act against it. And when radiation enters, we have a defense against it. The antioxidant. That's why we have lectures coming on vitamin C and vitamin E and beta carotene. Those lectures this year all about vitamin food supplements, because in the past 2 years we lecture about diseases, and this coming year we lecture about the vitamins themselves. What do they do, and how much we should take, and how important they are. Then after that, by the year 2000, we'll go back to diseases again if we're still alive. So radiation, also another factor. So all of these things enter the cell, the chemicals, and the aging process and effects, so we need good food supplements, so we need vitamins. And we need minerals, we need protein, we need better fat, we need better everything. Why do we need to take, I forgot to say something here. The aging material right here and the chemicals, there is a vitamin, have two hands like this. And that vitamin, when he sees the chemicals, he grabs it and takes it out. In his hand, that's called vitamin C. And vitamin E does the same, and vitamin B, beta carotene does the same. This is called anti-what? Oxidant. Now, if we have a tree that's growing, orange tree, that to make vitamin C or vitamin B or beta carotene or vitamin E, it needs trace minerals from the soil, it needs water, it needs air, and needs the sun. Correct? And if I tell you that the trace mineral is disappearing from the soil because in the past we used to eat the stuff, the food, and go to the bathroom and add it back to the soil called organic fertilization, and the cycle continues. By 1900, we canceled that. We added the chemical fertilizers, the nitrogen, the phosphate, and potassium, and we said, we know how to produce good food. We don't need this organic stuff, smells bad. That's what we did in 1900. Union Carbide came out with that. So, canceling the trace mineral, is this going to affect the amount of vitamins in this or no? Having water with chemicals, would this affect the vitamins here or no? Yes? Okay. Let's go to the most important one, the most serious one. Vitamin C is supposed to have two hands So it goes to inside the body and do what? It works as anti-what? Oxidant. If I tell you that the air around that plant have oxidant material called smog, and they can go inside the plant and fill those hands. Is this vitamin C equal to this vitamin C with empty hands? Because when you take that, it will not work. As a matter of fact, when you take that, it becomes a chemical, and you need to have another vitamin C comes in with two hands to grab it and take it out. So taking the wrong vitamin, because it's cheap, it can add more problems than help you. But they say in the bottle it's antioxidant. And they sell it for 80 cents a bottle. Or $7 a bottle and say it's antioxidant. Well, they can write anything they want because the FDA have lost their lawsuit against the people who want to produce anything they want with labeling. The FDA lost. Means anybody can take anything. If you can take dirt from outside and put it in pills and write antioxidant and sell it, you will win in court against the FDA. Still. They're going to say to the FDA, prove it, that the dirt doesn't work as antioxidant. FDA cannot prove it, they lose. You follow me? This is why you see so many products in the market, vitamin companies, saying everything, every miracle in the world they can produce, lies after lies after lies, and books and books and books of lies. And the only company I found out that produces actually good quality vitamin is Shaklee Company. For the past 20-something years, I've been associated with it, almost 30 years right now. But you cannot prove it. You cannot compete with somebody who produce a chemical vitamin for 80 cents. So the other guy can win, and the one with good quality will lose. But the people who are taking the quality vitamin will win, and the people who are taking the bad vitamins will still lose. And you will see somebody say, I've been taking my vitamins, I've been doing all of that, and I still have problems. And the reason behind it, because the vitamin he's taking probably not the right kind of vitamins. So the plant is being affected. This is why we need vitamins. And this is why we need minerals. This is why we need the proper protein and the proper fat. The last thing I want to talk about right here is the digestive system right here. If we don't have the proper nutrients, the colon, the digestive system, normally your colon have bacteria. 50% of your stool made of bacteria and 50% of fibers and water. And if there is imbalance in that, candida or yeast can grow inside, and they can disturb the stomach and cause problems. This is why Shaklee came out with the new product, which is acidophilus, which compared to the other acidophilus in the market, still much better quality, because the capsule itself is designed that it goes through the stomach without being damaged by the acid in the stomach, and it goes to the intestine. Where the other products, it will be destroyed in the intestine, in the stomach, before it goes to the intestine. And in each capsule, there's 5 million bacteria that they can go, natural one, to fight inside the body. So to summarize the whole lecture, it is 8:30 right now. To summarize it, we say the following. The causes of diseases are nutritional problem, chemical problem, or stress problem. And do we have nutrition problem? Do we have chemical problems? Do we have stress problems? So the three can cause disease. But the problem does not stop there. When you have chemical problem, will destroy nutrition and will cause stress. When you have stress, you will have depletion of nutrients, and also you will produce chemicals in the body. So all of these things are connected to each other. This is why we say the answer to the problems of disease in general and food supplements are the following. Number one, you must have a diagnosis what diseases you carry. So there is a diagnosis process like we do in my office to detect heart problems before you have a heart attack, or a stroke problem before you have a stroke, or cancer problem before you have cancer. I remember one person who's a Shaklee take lots of vitamins. I examine her every year, and one year I did a blood test for cancer. There's a blood test we can detect cancer ahead, and I find there is something possible cancer of the breast. Then we did a mammogram. We discovered cancer. We took it out, and she's still alive. 2 years later, we're doing the same test. We discover there is possibility of cancer in the ovary. Same person. And we went through surgery, and the surgeon looked at the ovary. He was looking at the scope. He said, it doesn't look like it has any cancer in it. I told him over the phone, take it out anyway, because the test shows there is cancer there. He took it out because and the patient agreed before surgery to that. And then when he opened the middle of the ovary, there was cancer beginning inside the ovaries. And you know cancer of the ovary is very serious cancer. Once it comes, it's very difficult to cure. So diagnosis is important. Nutrition by taking the proper vitamins and minerals and vegetable protein like Shaklee instant protein and the fibers and water and all of these things and acidophilus they come out with, and all of these things is important. Managing stress with exercise and sleep. You have good night's sleep and have good exercise to get rid of stress. Stress, you can get rid of it with exercise. Whatever stress it is, exercise overcomes stress. Because exercise itself can cause heart attacks. And stress can cause a heart attack. And if you put the body under both of them, stress and exercise, you will have a problem. So when you start exercising, the body say, forget about the children, forget about the problem, I better concentrate on my heart, and then you start feeling better with exercise. So during exercise, all the problems go away because you worry about surviving the exercise itself. Whoever thinks about a problem, you're going like this, you can't even listen. You want to rest, right? Because you're already short of breath. You already exercise. So exercise is important, and sleep, good night's sleep is important. Detoxification, that we remove the chemicals from the body by intravenously or by mouth, or by you yourself have to clean your air at home by having air purifiers. You clean your water at home by having best water filters, or you clean your food at home by having fresh vegetables and fruits and stuff like that rather than junk food all the time. Doing it that way, that will give you the answer you're looking for, that's why we need food supplements. The last thing I want to say, I'm going to put that back right here and give you my phone number. Is 847-356-9009. My name is Dr. Nasr. If you have a private question, you can call me and we can discuss any problem. There is no charge for phone consultation. Now, I'm going to ask you to, because it's an hour and a half already, I'm going to ask you to, if you have any questions about food supplements, you can ask it. Let us have the question about the topic itself not about any other subject. Anybody have any question? Yes, ma'am. With Optiflora health canker sores, no. Because Optiflora is against Candida itself, yeast in the intestine. It works in the intestine. It does not work in the mouth. It does not enter there. And you cannot have, otherwise you'll be drinking Optiflora in liquid. Because a strep and a streptococcus, that kind of strep, has to go in a capsule very tight to the intestine. Because if you get it in your mouth, you will have a strep throat. If you get it in your intestine, you will have infection in the digestive system here. It only works in the colon where it's dirty. The rest of the body, from small intestine to the mouth, is clean. The only part has lots of bacteria is the colon. And that's what most of our problems are. Oh, that's a topic by itself. That's the herpes virus 1 and herpes virus 2. That's poor immune system. That needs all the supplements, everything. Any other questions? Yes?
Should everybody take Optiflora?
I would say if you feel that you have problem with digestive system, gas, indigestion, problem absorption, constipation, diarrhea, problem with it, yes, you should. I cannot say everybody should have Optiflora. I cannot say that. But I would say most of the people, all the people over 50 should have it, yes. But below 50, I have to be selective. You have a question?
Yes. How is, if somebody wanted to start the Shaklee product, what would you suggest as the beginning thing?
Well, the question, if somebody wants to start Shaklee products, what do you suggest? The basic, Dr. Shaklee recommendation still stands the basic. The Vitalia, the instant protein are the most important two. Still stand number one, and nobody can have changed that. As a matter of fact, in those days until now, there's a guarantee about that. I don't know if Shaklee still have a guarantee or not. They still do? Okay, you have a guarantee if you don't feel better taking it. So we have to stick with those and add to it the rest of it. I had a table right here to show that the instant protein, the Vitalia, the B-carbon, the C, the E, the alfalfa, the garlic, the calcium, the fiber, the Formula 1, the beta-carotene, the iron, the lecithin, liqualia, performance, or physique, EPA, DTX, astacanase, palmital, all of these things that, for example, children, 0 to 1, we didn't give them all of them, and we keep giving more and more with age. As you can see, it gets more. The older we get, the more problem we have, the more we need. So I can't tell somebody I don't know how much exactly of clarity you want, because I have to know how much blockage he has in the brain or to the heart. I can't determine it specifically, but I suggested in the table 1 to 3, 8 to 10, 0 to 1, 2. I made a range right here, as you can see, so one stays safe in the safe range without having problems. So if you stay in the lower range, there's no problem. If you want to be specific and have more, then you need to have a physical examination that we have to determine how much you really need of supplements, and that's the best way is to be accurate. Yes?
Okay. So the sake of argument, and taking into respect all of your degrees and everything that you have, with all the vitamins that are available today, and they're all subject to the same chemicals from the air, the oxygen, things like that, the water, what would make Shaklee stand apart from the rest? Just for argument's sake, if somebody's going to come up and say, well, as far as affordability, I can get this for 80 cents a pill.
Yeah.
That, if they're all exposed to the same thing, what makes this product different?
First of all, the difference between Volkswagen and Rolls-Royce and Mercedes. You ask each one, they will tell you, my car is a better car. And we know by a fact, experimental life, and certain company make a better product, certain company make bad product. And that's the answer to that. We tell the person, believe what I say or don't believe what I say. Just like somebody, you tell him, God exists. Said, no, he doesn't exist. We tell him, okay, fine. I believe in that. You don't believe in that. Let us go away, and when we die, we will find out the truth later on. With nutrition, we say to the person, you don't have to listen to what I say. Take what you want. I take what I want. In 10 years, if you're still alive, we'll find out how you feel, and that's the answer to that. There's no reason to argue of somebody who doesn't have a brain. Okay, yes.
I just want to suggest to her that if she gets that sheet that we have, pamphlet, on the shackling difference, that really helps.
Well, yeah, but here argument is true that you can't. I have patients argue with me all the time about this point. All the time. They ask, I have people that I tell them take it, and they say, no, I'm not going to take it. I have lots of patients. Tell them, you take this. They say, no, I'm not going to, I'm going to take this. And I tell them, fine. And within 2-3 years, they start having problems, and they switch, and they feel the difference. I don't go, here I told you so, because that's not nice. I said, okay, I'm glad God opened your head to the truth, and then you are listening. Because, we have a radio and TV and newspapers that brainwashing our kids, and you're competing with environment and everything that telling them that beer is better than water, then Coke is better than water. Is that true or not? Advertising on TV that beer is better than water. Is that true or not? Remember the ad that I told you many times in many lectures? The guy walking in the desert, and somebody offered him a glass of cold water. He said,